Am I on?
Okay, I'm
Okay,
going
it
to turn
is
my
5
mic
o'clock.
off. Okay, honey, I'll leave it there on the front. Thank you.
We are going to go ahead and get started. Thank you, Mrs. McChrystal.
You're welcome.
Okay.
Am I on still? Oh, this never floats. This thing doesn't float, whether it's,
Okay, okay, we don't have Father Switz, so, this is the first meeting of the new fiscal year, and there was a change to the agenda, and we are adding TCCH on, along with it for their quarterly report. So that was a change to the, apparently we will not have the invocation tonight, because Father Switz is not here. So we will go do the Pledge of Allegiance. Michael?
I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible,
and justice
for all. First order of business is the consent agenda. So if I could have a motion for approval of the chairman's budget discussion meeting minutes dated September 9th, the first public budget hearing meeting minutes dated September 12th, the hospital district and We Care joint meeting minutes dated September 18th, the final public budget hearing meeting minutes dated September 19th, and the regular monthly meeting minutes dated September 19th, and an October disbursement of, Mr. Jones?
so
So
moved.
Thank
moved.
you. All in favor?
Aye.
Thank you. September was a busy month. Okay, I have really nothing new at this point in time, so we will go directly to Jennifer Peck.
Okay, thank you, Madam Chair. Again, I'd like to just update the board. We spent a lot of time the last couple of months, not only with the budget, but then getting all of the funding agreements in place, the leases in place with the Gifford Health Center, the subleases in place. I'm happy to report that we are nearly in a position of having all fully executed documents. We have everything now related to Gifford, so all the full lease with TCCH and both subleases are fully executed, and we are almost there with the agency funding agreements following approval of the final budget. So Jenny has been working hard to get those to me to review, which we did pretty quickly, and then turn them around to get them signed and back so that we all have fully executed copies for the files. So that's been a lot of what we've done. And then also this past month, of course, I was asked to work on the research regarding options for the district's reserves, investment options, and in general, what we are able to do with our surplus funds as an independent special district. And we did have quite a bit of good beginning discussion on that yesterday at our meeting. If anyone has any other questions for me at this time, I'll be happy to take those.
I have a general question on the funding agreements. This year, they also include the quality metrics, right, or the metrics that they have identified. Is that something that you can share with all of the trustees, what those metrics for each of the agencies is? Okay. I think that would be helpful for us to know. Okay, thank you. Any other comment for Jennifer?
Just like to thank you for a very fine report and for all the work you've done the last 2 years.
Well,
You've been extremely busy for you.
thank you, and I appreciate it. It's good work to do, and I enjoy working with all of you.
Okay, moving on to the financial statement review. Mr. Jones?
The district completed the most recent fiscal year in sound financial condition, and our bank accounts have now been moved to Vero Beach location as opposed to one a little south of us when we changed our accounting services that we discussed and approved earlier this year. As of September 30th, the district's bank accounts totaled $5,075,000. Current liabilities for the month, which we just approved, are a little over $1.2 million. So as we move into the current fiscal year, the district will carry over funds of about $3.95 million. Of that total, $1.5 million is expected to be necessary to cover the district operating expenses until new tax receipts begin to be received in the second half of November. The balance of the funds can be invested to earn additional income until the funding requirements materialize. In the recent past, the district has earned nominal amounts of money on its demand deposits. Last year, that amount totaled just under $18,000. But in the last few years, the trustees have returned reserves to the taxpayers and maintained minimal excess funds. Because of the evolving nature of the district's responsibilities, we have determined to carry somewhat more reserves than in past years, and thus we're developing a more extensive interest-bearing investment policy. More on that in future meetings, as Anne Marie Soriano and I are developing alternatives for trustees to consider. The goal is to have the program established before the tax receipts begin to be deposited in mid-November. In the meantime, the public should be aware that the hospital district millage rate is declining for Indian River County taxpayers. And the decline will likely continue when the district's responsibilities to the hospital cease at the end of fiscal year 2021. This year's millage rate is 0.8011, down a little more than 12% from last year. As recently as 2015-16 fiscal year, the millage rate was 0.9951. So our 0.8011 is down nearly 20% in the last few years. Having said that, the trustees discussed this topic at some length at the chairperson's meeting yesterday, and the consensus is our priorities are first, I'm sorry, that's my phone, except I don't, anyway, it died. We discussed this yesterday at a chairwoman's meeting, and we decided that our priorities are first, supporting important services that improve the health of our community residents, and then, second, doing so in a responsible manner to minimize the tax burden on residents. That concludes my report. If you got any questions, I'll be glad to address them.
Thank you. Any comment to Mr. Jones? Okay, more on that whole issue will be coming. We have a lot more discussion to have on that. Anne Marie Soriano is not here. Her report is included with this. So we'll move into the funded agency reports. And first up is Brett Hall with the Mental Health Collaborative. Welcome, Brett.
Thank you. Thank you for having me here to report on the Mental Health Collaborative. So we have just ended our third full fiscal year. It ended very well. We had a busy year. We had our membership meeting in September of this year where we reviewed with our membership in the community our accomplishments for the year. First off, supporting the 19th Circuit court system with their guardian advocate program. As you know, a guardian advocate is appointed by the court for someone that does not have a family member and has been determined to not have capacity to make well-reasoned and informed decisions by the magistrate. We have provided that support to over 120 people in our four-county area, the 19th Circuit, over the last fiscal year. So these are folks that did not have decision makers for them. So we consent to treatment, we consent to medications, et cetera. So that's a really good service that the collaborative was able to provide. Without that service, hospitals could not treat the patients. They would just sit there and languish until a court would order medications, which is a very long and laborious process. So we're really happy to have provided that service to over 120 people over the last year. Our behavioral health therapist provider group, we are pulling the therapists together to really support them and increase their clinical skills in our community so they can in turn provide great skills or great services to our community. We have, and with that, we meet every other month We've pulled in 32 different therapists in town, where these folks have never sat in a room before the last year or so. And also, I am now the NASW subunit chair for the Treasure Coast, which means that the collaborative can extend the NASW, National Association of Social Workers, infrastructure and provide CEUs to our community. So far this year, we've provided 7 free CEUs to the clinicians in town, which is a really great service. We have another CEU event next week for another 7 CEUs. So this is a really invaluable service that we're able to offer. And it's for social workers, therapists, clinicians, psychologists in town. Our plan is to move into CMEs eventually and try for nursing also. So we're going to work on trying to expand that program. We have our Building Community Awareness Committee, which is working to reduce the stigma of mental health issues in our community. And we came up with our logo of Stigma-Free IRC, which we're really excited about, to help tear down that stigma of reaching out for help. And we have our big event this weekend, Saturday. It is not going to rain here, so I'm just letting you know that now. I have willed it. Food Truck Frenzy, Feed the Soul. So we'll have food trucks out there. We have 24 providers that will be out there. We have activities for the kids. We have demonstrations on Tai Chi, yoga, guided imagery, some other things. We're also, we're competing with Touch a Truck this weekend. So we wanted to outdo them. So we're going to touch a therapist. But then I thought we really can't touch a therapist because there's some liability that goes with that. So we're going to walk with a therapist. So if you want, if you had any ideas or any thoughts about what therapy is or might be, you have the opportunity just to take a 5-minute walk with a therapist and realize that they're not creepy people and are, besides me, most therapists are very normal and very helpful. So we're going to have some really great activities out there this weekend. It's in Riverside Park under the Oaks, 10:30 to 2:30 this weekend. That was a shameless plug and commercial, but I'll take it. That's our event this weekend. And then Mental Health First Aid. I think we've talked about this before. So Mental Health First Aid is an evidence-based international program that teaches lay people how to identify signs and symptoms of mental health issues and substance use disorders, how to have a non-judgmental conversation with them, how to get them into supportive and professional services. So we have done a demonstration project. Myself and my colleague are trainers for this program. We have trained 83 people. We did this demonstration project as a grant from the Fund for Better Mental Health at the Community Foundation. So we became instructors. We've trained 83 people in this program. I'm working with Anne Marie to set up a training for y'all so you can sit through and experience this curriculum. It's a really great program, and I have gotten 3 or 4 responses from folks that we've already trained that says, I've had to use the techniques that I've learned in action already, and it really makes people more comfortable. People are afraid of mental health issues because they don't understand them. This class helps to teach to demystify these things. I say in class, we talk about hemorrhoids, but why can't we talk about depression? I mean, are you kidding me? It's 2019. Let's have these conversations. So that's Mental Health First Aid. We did pre-test, post-tests, collecting data to write an Impact 100 grant. Our goal is, if awarded the Impact 100 grant, we will train 40 other instructors in our community. And our goal is to train 25,000 people in Indian River County over the next 10 years. So we really think that this will be transformational for our community. So that's what we're working on as far as the collaborative. And then we have this little thing called the McCabe Connection Center, which is going really well. As you know, this is the access point where people come and get screened and connected with services in our community. For this last fiscal year, we're averaging 95 folks in our community a month that we're seeing and connecting with the different services in town. I've included some reports in your packet. We're still seeing approximately 80% adults, 10% adolescents or kids, and 10% seniors. We're male and females pretty close, 50-50. So that's going really well. Our outcome measures for that program, people are exceedingly happy and satisfied with the services that we're providing. And we've seen now over 3% of the entire population of Indian River County, which is 2% of our entire population we've seen in under 3 years. So we're having fun.
Busy.
Busy. Any questions I can answer on the stuff that we're doing?
Your mental health first aid,
Yes.
what's the youngest age you teach that?
So there are different curriculums. We are teaching the adult curriculum. There is a youth curriculum attached. We are not instructors in the youth curriculum currently, but when we go forward, we will, part of those 40 instructors that we hope to train, we will train 10 to 15 of those 40 will be youth instructors. And it's interesting that you bring that up, because under the Marjorie Stoneman Douglas Act, the governor or the legislature approved that every school personnel from bus driver to superintendent must be trained in mental health first aid in the next 5 years. So we do have some school personnel that are trained, and they're pushing forward and training the school personnel in the youth version. There is an adult version. There are a couple others. There's a first responder unit that we can also explore.
I believe we have a date of February 7th, right?
Yes, we threw out a few dates. February 7th. So you'll get to see me for 8 hours. How lucky for you.
Actually, Anne Marie said you can do it in 7, so.
I can do it. As you can see, I'm kind of a
February, you think it'll
So.
probably be 6.
as you can see, I'm kind of a fast talker, so yeah, we'll get through it.
Well, I would like to thank you. I mean, I think this has been a really wonderful thing, both the collaborative and the Connection Center in the community. The Connection Center, where do people get referred to the Connection Center from?
From all over the place, everywhere. I mean, there's a report here where our referrals are coming from.
So do you feel like it's known within the community?
I do. I mean, I really do. And they are coming from everywhere. And our biggest referral source is we have little blank business cards that just say the McCabe Connection Center, name, address, and phone number. People walk in every day and say, this is my get out of jail free card, or, you know, so-and-so gave me this card and told me to come talk to you. So my first question is, well, why are you here? I don't know. Well, let's get some coffee and sit down and let's have a chat. So those cards are in every police, most police cars. They're on every judge's bench. They're in the emergency department. They're in every provider's front desk. They're hanging at the library. I mean, they're everywhere in town. So we have that. I mean, we do lots of print media and radio advertising. But then invariably every week I run into somebody who says, you've been here 3 years, I've never heard about you. So, you know, it's just, we'll keep at it, but I liken it to the story of the red Toyota, right? If you're not interested in a red Toyota, you don't see any of them. But as soon as you want to buy a red Toyota, you can't stop seeing them, and they're everywhere. Well, it's the same thing with mental health. When you hear all these things about mental health, it's like white noise, and it just passes you up until it hits you. So as soon as you have an issue, then you start paying attention. So.
I can attest to it because my husband Michael is one of the veteran court mentors for the Veterans Court. And this was someone who had been through the program, who was a veteran, had some help through the VA, but we had hit a stumbling block. And I said to Michael one night at dinner, I'm like, you need to get a hold of Brett at the Mental Health Collaborative. Subsequently, we did, and they were graciously able to help with that situation, so
That's great.
that was
Yeah.
good.
I mean, you hear positive stories all the
That's
time
because
about
you knew about it, right?
Right.
Right, but Michael didn't, so now the word is out, so he didn't really realize that, so.
And I sit in Veterans Court.
I know you do. I know.
I could throw a piece of paper and hit your husband.
I know. You know, I think sometimes the hearing aids aren't on, you know? Yes,
Not paying attention, we call it. I say that to my husband all the time. They're not listening.
Well, thank you. We appreciate it and
Oh,
everything that you're doing, and we're going to pray it doesn't rain Saturday.
No rain, no
And this
rain.
is a huge success, yeah.
Yeah, great, thank you so
Yeah.
much.
All right, thank you, Brett. TCCH, Vicki. You're not tired of us?
I would say the reverse. You guys are probably getting tired of seeing me all the time. However, this is my quarterly report that closes out your year end. Our year end is actually December 31st. So this is always a challenge for me to make sure I have the numbers right, and there are a couple of corrections, minor ones. But we usually spend our time talking about numbers. Let me see if I can do this. Okay, Katie, you can't sit down. Up does not go up. Oh, good, it's not just me. I thought her magic touch was coming over. So there are numbers in, did you have time to give them packets?
Yes.
Okay. So if you turn to page 1, we're going to talk about quality, because we're always talking about numbers and increased number of patients and sites and all of that. But the number one concern is, are we giving good quality care? So first off, okay, that's fine. You just click for me. So the first question is, how do we measure quality from a broad perspective? And usually, most healthcare organizations look for some outside objective agency to accredit them, to come in and evaluate from their perspective. And so we went through this drill again. This is the third time that we have had the AAAHC folks in. They are the equivalent on the outpatient side to JACO. And so we received accreditation there. We are also, by virtue of being a federally qualified health center, judged by HRSA, the Human Resources and Services Administration. So last December, we were given the news that we would be funded again for 3 years, and they only do that if you prove that you have a quality organization. But if you go to the next page, you'll see that defining quality is usually something that doesn't require outside agencies. It's something we judge every day, and according to the dictionary, it is the standard of something as measured against other things of a similar kind, or the degree of excellence of something. And I point this out because I'm going to show you some data that when I first looked at it, I went, oh my gosh, because I'm used to aiming for 95 and 100%. But the difference between being in a hospital and an outpatient is, in a hospital, they're in your bed. You control them for 24 hours a day, what they get, what they give, okay? We have about 15 or 20 minutes in front of our providers, maybe an hour with all of our team to make an impression, and after that, folks go on their merry little way, and they may or may not do what we suggest that they do. So we were really surprised and pleased that HRSA, who takes all of the data from all of the community health centers this year, recognized us not as a quality leader, because we've been in that position for about 3 years already compared to other community health centers, but this year they chimed in what the inspectors, the surveyors, they're not inspectors, the surveyors from AAAHC told us that our behavioral health program has grown both in breadth and depth to a point that they don't see even in California, which I guess is their standard of quality. And so we were recognized as a national quality leader in our behavioral health services, which is given to only 1% to 2% of the 1,344 health centers across the country. So I'm very, very proud of our staff and the work that they do. Moving on to the next page, you've heard me say before that HRSA is, they give a dime and they ask for $1 worth of data. And so this is a snapshot of one of those measure feedbacks that they give us. Again, we give them a whole composite of things in February, March, and April, and then they compile and analyze all this information and then give it back to us, usually in August or September, that show us how we do against other community health centers. And so you'll see that some of those things are weight and follow-up plans. This is the preventative health screening page, and I'm happy to say that on this page, our preventative health measures, we score very well. We're in the first quartile or second quartile, so we're at the top slice of most of these things. But again, I'll draw your attention to things like the third one down, the colorectal cancer screening. We work real hard to get people to do their screening tests. We talk to them a lot. We send it out, we call them, we talk to them, but it's not a test anybody's really waving their hands and saying, yeah, let me go in the bathroom at home. So while Healthy People 2020 goals are to have 70.5% of the United States doing colorectal cancer screenings, and we all know somebody who has suffered and/or perhaps even died from colorectal cancer, although that's not as common, the death part anyways, anymore. The reality is that we've got a job to do, and so do all the rest of the folks that are dealing with outpatients. Cervical cancer screening is pretty much the same way, although the reasons may be different. It might be more that there are barriers to having it done, perhaps the expense of the test, the convenience of getting in to see the practitioners and those types of things. And childhood immunization status is the last one I will point out because this mortifies me, but we were running in the 90s, the high 90s, in our childhood immunization status until they changed the rules 3 years ago. HRSA said, it's wonderful that you're giving measles, mumps, rubella, all those good things. They give us a list of every immunization that the child has to have before their second birthday. And one of those was a flu shot. That's why we were running in the 90s. Now you have to have the infant have 2 flu shots before their second birthday, or you score 0. You can have 100% of the remaining 20-some immunizations, but if they don't get the 2 flu shots, and it's really, really, really difficult because A, you can only give them within a 6-month period, not the whole year, so part of that is timing. And then the birth of the baby, a lot of moms will tell us, you're not sticking my 4-month-old again. Sorry. Next time round, maybe. Okay, well, next time round, they do get the flu shot, but we get a 0 for that child's participation. So sometimes the numbers are very helpful and sometimes they're not. But as you can see, we still stand in the health center first quartile because other community health centers are having the same problems. I'm sorry, the second. If you move on from the preventative screening, Mr. Jones, you'll see I put this one on the top of the page. Early entry into prenatal care is certainly something that HRSA knows is very important. We are one of the few community health centers that refer all of our pregnant moms out. We referred out 94.84% compared to the other values. They're anywhere from a goal of 78% to similar CHCs, 72 and 73%. But where we had a blip on the radar this year was we follow those patients over to Partners and anywhere else that they go. And if they deliver a live baby of less than 2,500 grams, that dings against us. So 11.4% of our patients, which is probably only 1 or 2 patients because we don't send that many that deliver every year. So it is what it is. And then chronic disease
My
management.
ignorance, what is, how much is 2,500
Yeah, I was gonna say, how much is the
grams?
weight of?
It's very small. Anne-Marie, you wanna? I mean, it's like,
No, you know, I was looking at other statistics down here, so it
I
wasn't.
think it's under 4.5 pounds.
Under
4.5
Yeah.
would be, yeah.
Is that about right?
I would think so, yeah, because 5, we have a doctor in the audience. Can you give us an answer, James?
2,500 grams birth weight is,
There you go.
We turned
way to
ours
go,
off.
doctor.
About 5.5 pounds.
How much?
5.51 pounds.
5.5 pounds.
5.5.
5.5. I was close. I got the 0.5.
Thank you.
No, that's not that little.
It's a viable baby,
Right.
viable baby, yes. Yeah. Yeah,
Okay, thank you. That, it just helps me put that.
right.
Yeah.
I'm sorry. I was looking at some of your other things at the
That's
time,
okay.
so, go ahead.
All right. Yeah, we all learn something new, and I used to know that, but not up here. So chronic disease management is certainly the thing that we work on the most with adults, but again, it's easier to train children than it is to retrain adults. And so things like taking your medications for lipid therapy, we get 80% of our patients to do what they should do relative to coronary artery disease, that is making sure that they aren't all plugged up, the statins that reduce your cholesterol. But as you can see from the very tight ranges, so do all the other community health centers. So even though there's only a 2% difference, not even quite, about 1.5% between us and our peer group, we fall down into the third quartile. So it's a really tight range. We're all working on this to keep our adults healthy, stroke-free, heart attack-free. Controlling high blood pressure and A1C control, which is a measurement of how effective you are on diabetes, is also a very tight range. We're trading a lot of best practices, a lot of encouragement. So there's a lot of enthusiasm among the community health centers to make those things happen. But again, we get 15 or 20 minutes, and then we're at the pleasure of the individual to come back or not for additional work with our team. And as I keep explaining to our team, which they already know, it's not a one and done. You know, if you have a chronic disease, you need to be coming in to an affordable place and having those conversations about what are you doing, what can we help you do differently to stay healthy longer, more actively. So that's all very good in terms of the quality measures. In some way, though, go ahead, it really is measuring how good are we at documentation in many instances, and that doesn't always translate into real health care. And so I am presenting for the first time some of our patient survey data, both by percentages and by volume, because there have been some folks who have suggested that we only count 50 or 100, whatever makes us look good. So you can see that I've given you both the numbers and the percentages. And the lowest thing, because our eyes always drop to what's the lowest great reading, 65% time in waiting room was acceptable to 65%, but another 25% said it was very good. And so those numbers add up to 90%. So we continue to share this information with all of our staff, our provider staff, as well as our support staff, and they have discussions within their centers to talk about their specific numbers and what they reflect and what processes could be acting as a barrier to getting better responses from our patients. So that will be a work in progress forever. Would you recommend us to your friends or family? 92% of this quarter's surveyors said yes. So we know we've got more work to do. We want that to be 100. Moving on, this is a traditional slide you've seen before. I made the middle columns pink just for variety. Those are the real numbers that I'd like you to focus on. It's the total volumes versus last year's volumes. And you can see for medical services, for the district portion, the medical visits went up by 32%, patients went up by 44%. So again, this is one of those situations where we saw more patients who didn't have quite as many visits as we have had in the past because we've had many new patients coming from the health department and our 787 building that we just opened in December. You can see that overall our medical visits went up by 11% and our total patients went up by 8%. However, notice that the percent of uninsured patients went up by 9%, and that will be a repetitive theme you will see on the next couple of pages. So moving on to behavioral health services. You're not the only one that can talk fast, I guess. On behavioral health services, again, you can see that we saw many more patients than we have in the past. We are also offering more visits as a corollary, and there is a correction on the percent of patients who are uninsured. There was a 9% increase in the behavioral health section. From 9% to 18% is 9. We were on a rule of sevens, I guess. 7, 7, 7. So again, quantity is not quality, which is why I give you both sides of that three-legged stool, and then patient experience being the third. Dental services evoked quite a conversation with our dental services manager because we have seen more dental patients and we've seen more dental visits, but not necessarily those that were qualified for the hospital tax district discounts. And so she said, not to worry, that's all corrected itself. Just about every patient that comes in is from the county, and they're so grateful that we're going to take care of them. So that's a really good thing. But again, she did relate that the percent of uninsured patients at 31% is 11% higher, not 31%. But it feels like 31%. And her explanation, which we went back and looked at, is that people are dropping their insurances. So
But they
they don't cover anything. That's what we're hearing.
They don't necessarily qualify
Correct,
for district help.
correct.
They just don't have insurance, and they're going cold.
When we went through, and we're doing more, so I'll be able to give you more information perhaps at a chairman's meeting, because I'm not scheduled to be up here for a bit. We have some snowbirds, you know, they have a family physician at home, but when they come here and have a toothache, they want to go someplace close, affordable, that they can get in. We also, as I've explained to you before, we also have community health centers on both sides of us that do not have the extensive dental services and chairs that we do, so they come in from other counties. So we're taking a look at the possibility of giving preference to those folks that already use us for medical and behavioral health services in terms of getting into dental, because that is a concern that if someone else is filling the chairs, not our own county residents, then that's really not what we're all about as partners. Okay.
Would a piece of that also be seniors? Because dental is kind of one of those things that you drop off when you go to Medicare.
It may be,
I'm
but
just curious.
that's sort of a steady state.
Yeah.
You know, in terms of the number of people that we see that are on, you know, going into Medicare, we haven't had a serious blip, like all of a sudden 5,000 of us turned 65 this year, so. And so, going to the last page here, the district reimbursement for our services from this past year, number of encounters as opposed to budget dollars and budgeted dollars. And so you can see, if you fall to the bottom line there, that we were under budget by about 30-some thousand. But my dental manager says, hold on to your socks. We're seeing a lot of referrals. Yeah, yeah. Okay, can I answer any questions? I thank you for your.
Could I
attention.
ask a question? I know this is rather technical, but colorectal cancer is very prevalent. And a lot of people just can't even think of a colonoscopy, you know? I mean, it's a life-saving situation, but just the thought of it. But you do colorectal
We do screening.
exams, but smears, you're doing smears, okay? You're not giving Cologuard or something like that. That's 92%.
Yes, we are.
You are. So, because I don't know if, you know, you see it on TV all the time, but it's 92%.
And most insurances
accurate.
will cover it.
Yeah, but you do have, now, do they have to pay for that if they want to take that Cologuard home and go ahead and, is that how it works? It's not a gift that one gives out. I mean, I'm just
Honestly,
thinking about the need. Suppose everybody that needed a colorectal screen got a Cologuard and was able to send it in. What, would we have an effect on that disease in our community? I don't know.
Question
we've
is,
been-
would they use it too?
we've been doing something very similar in a kit that we send home with them, okay? It's just not very popular, you know.
No, it isn't. No,
Regardless
I
of the
know.
cute guy on the commercial that bounces
Yeah.
around in a
Oh, I
box.
know. I know, it makes it cute, but
Um,
it's not very cute. Okay.
Very cute. So we encourage people to return that, and only those that show up with a positive screen then would go on for a colonoscopy, okay? Or that have obvious, like rectal bleeding when they come in.
Yeah, you just wonder how many people are really being touched by it all. And then cervical cancer, you know,
Exactly. That's what
exams.
we-
There's
that's-
another one right there.
That's what we added to our Women's Health Fund,
Yeah.
our philanthropy piece, because it started with mammography, but
Mm-hmm.
we recognized that a lot of women were not getting their pap smears as well. and
Right.
That is just as serious.
There are some new techniques other than the pap smear. I know because our daughter Kelly is in global health, and there are some new things that they're using in the third world.
There are.
or introducing, and they're very effective. They've been discovered here, and I just don't know if we're going to be doing that rather than the old-fashioned pap smear, so.
Well, it's always dependent on getting the man or woman into the center in the first place, and then we have those discussions, and we work real hard to remove those barriers,
Yeah,
working with philanthropy and dedicated funds.
right.
So, you know, I would say that most of it is denial or fear factor. It's easier to ignore it or put it off.
It's always an ignore. Maybe it'll go away.
Yeah,
Ignorance is bliss.
exactly. So, anyone that's listening out there, please contact one of our family practice providers through our call center and set up an appointment.
Right.
It's a moment of humiliation, 'cause nobody likes to talk about, much less do it.
But it
But
saves a life.
it saves lives, and unfortunately, we do see folks coming in still at stage 3 and stage 4 cancer diagnosis. So,
True.
thank you very much for your support.
Other question? Wait a minute.
Yeah, I had a question. Why do you, or can you explain why the medical visits and the behavioral health visits for the district-eligible patients are up so much more than your other patient populations?
Well, I would guess because you have helped us make it more affordable.
You think that's what it
And we
is?
are qualifying people like crazy. Our health navigators are booked out weeks now to try to get folks, and we've added staff to try to reduce that backlog.
But this is for the last quarter of our fiscal.
This includes the last quarter, so this is a full-year report,
Okay, but
okay? But it
But-
goes up to September 30th.
I think this next year, it will make it even more so, right? Going to the 200% and easier
Correct.
requirements. But I don't know that anything changed for last year. Well, the health department, I know you picked up a lot of
Oh, yeah.
people from the health department.
I bet that.
And that started back in June.
Yes, yes.
So you've
Good
got a
point.
good, you got a
Yeah,
good
we're
3
doing our
months there
job.
of patients calling in.
Well, thank you for the
So that they're
very
reacting in
thorough
the way you
report
wanted
and
them
the
to. They're coming
quality
in
of
and,
what you're doing. Thank you.
Vicki, where is your busiest site?
you know, I get asked that frequently, and I would have to say at this point, by a nose, it would be the Kmart Center in Central Vero.
Which is going to close?
No, did you hear something I did? Kmart's closing, not our center.
Kmart.
Stop that.
Didn't you say Kmart?
Oh,
The Kmart
her.
Plaza.
Oh, the plaza.
Plaza.
Oh, I thought you were like right there by
No,
Kmart.
no, we're up next to the
You're up
post
by-
office.
right.
Oh, yeah.
So
Yes,
that
I've seen your, I've seen
Oslo
you. Oh,
Fest-
yes, that
Oslo
center
Fest
right there, yes.
are our
yes.
busiest, but I don't think it'll take all that long for 787 and Gifford to come up, honestly, because we're seeing more and more patients
At,
coming.
at GHC? Yeah, which is wonderful. We're very excited about that.
It is very
Well, it's
wonderful.
been a
Yeah.
busy year for you.
Yeah.
Just in case, I brought the visits by zip code, if anyone's interested.
There you go.
Okay.
That's interesting. Yeah.
Thank you all very much.
Thank you very much. Okay.
Appreciate it. Any unfinished business? Any new business? Any other business? I never really understand that. Okay, any public comment?
No.
Any funny business? Hearing none, we will adjourn. Thank you so much.